Hello learners, welcome to lecture 40. In our last session, we discussed community organization and mobilization for RCH, emphasizing how collective action drives better health outcomes. Today, we will focus on social work practices in maternal and child health, an area where professional and community-based social workers have made significant contributions. Social work combines empathy, advocacy, and empowerment with practical interventions, ensuring that maternal and child health services are not only delivered but also equitable, respectful, and accessible. This lecture will highlight the roles, methods, and challenges of social work in advancing maternal and child health outcomes. Maternal and child health is more than a biomedical issue. It is deeply influenced by social determinants such as poverty, education, gender norms, and community support. Social workers bridge the gap between health services and communities, focusing on equity, rights, and holistic support. They play a very important role in ensuring vulnerable women and children are not left behind from services due to stigma, discrimination, or socio-economic barriers. Social work in maternal and child health encompasses multiple roles. Social workers provide counseling and psychosocial support to mothers experiencing stress, postpartum depression, or domestic violence. They advocate for women and child rights, ensuring families can access government entitlements such as free maternal care or nutrition schemes. They also serve as connectors, linking families to health services, welfare programs, and community resources. Social workers act as boundary spanners across institutions, home, clinic, school, police, and courts, so that rights on paper translate into timely survivor-centered support. Practical tasks include safety planning, trauma-informed interviewing, and assisted referrals to antenatal care, mental health services, legal aid shelters, and child protection bodies. They help families navigate paperwork for schemes, reduce stigma through group counseling and peer support, and coordinate case conferences so medical, social, and legal plans align. Equity work is central. Social workers identify barriers linked to gender, caste, disability, and migration, arrange transport or childcare, and ensure reasonable accommodation for adolescents and persons with disabilities. Finally, they use community education, home visits, and simple dashboards to track follow-up and outcomes, making care continuous, accountable, and genuinely family-centered. The principles guiding social work in maternal and child health emphasize dignity, respect, and empowerment. Women and children must be treated with compassion and seen as active participants in their care. Equity ensures services reach those most disadvantaged, while justice demands structural reforms to remove barriers. These principles align with human rights and community-centered approaches we have discussed in earlier lectures. Building on this, a rights and capabilities lens asks social workers to co-create care plans with mothers and adolescents, ensuring informed choice and shared decision-making rather than paternalism. Operationally, dignity means trauma-informed practice, privacy, and culturally safe communication. Empowerment means strengthening self-efficacy through peer groups and skills that help families navigate health and welfare systems. Equity requires proactive outreach to those facing layered exclusions by gender, caste, disability, poverty, or migration, using reasonable accommodation, transport support, and flexible things. Justice extends beyond the clinic to advocacy for safer places, gender responsive budgeting, and enforcement against child marriage and violence, so individual care links to structural change. Finally, accountability comes from simple disaggregated dashboards, and community feedback mechanisms that make services responsive and sustain trust over time. Maternal health challenges often disproportionately affect marginalized and vulnerable groups of women, such as rural women, adolescents, and those living in poverty. The three delays model: delay in deciding seeking care, delay in reaching the facility, and delay in receiving the treatment continues to be a major contributor to maternal mortality. Social workers play an important role in addressing these barriers by providing awareness, facilitating transport, and advocating for timely, respectful services. Child health faces similar challenges, particularly malnutrition, preventable infections, and low immunization coverage in underserved areas. Social issues such as child labor, neglect, and abuse further complicate child health outcomes. Social workers intervene by connecting families and nutritional schemes, mobilizing communities for immunization drives, and safeguarding children from exploitation. Their holistic approach addresses both medical and social determinants. Counseling is a core function of social work. In maternal health, counseling during antenatal and postnatal periods provides emotional support, addresses fears, promotes healthy behaviors. Social workers screen for anxiety and depression, often overlooked in routine care. They encourage birth preparedness by discussing danger signs, transport plans, and financial readiness with families. Even their discussions extend to feeding of the child, like how to start breastfeeding for a new mother, and further into the nutrition of the children, thus reducing maternal risks. Counseling in child health includes educating caregivers on nutrition, breastfeeding, and complementary feeding practices. Social workers encourage adherence to immunization schedules and help parents overcome misconceptions. They also guide parenting skills such as nurturing care and stimulation, which are crucial for cognitive and emotional development. Through counseling, families are empowered with knowledge and confidence. Community outreach is a defining feature of social work practice. Home visits allow social workers to identify high risk mothers and children who might otherwise be invisible to the health system. They mobilize communities for health camps, bringing services closer to the underserved. They also raise awareness about entitlements such as free maternal care or supplementary nutrition, ensuring families can claim their rights. Building on this, outreach reframes families as right holders, not passive beneficiaries. Social workers co create action plans, ensure informed consent, and connect households to antenatal care, immunization, and nutrition services through clear referral, counter referral loops. Timing visits to accommodate women's work, providing assistive support for disability, and engaging mothers in law, fathers, and adolescent peer leaders. And again, engaging mother in law, fathers, and adolescent peer leaders to shift household norms. Practical tools like registers, simple dashboard tracking, follow ups by gender, caste, and group meetings in Anganwadis or schools turn outreach into accountable, equitable service. Practical tools, risk registers, simple dashboard tracking follow ups by gender, caste, disability, location, and group meetings in Anganwadi or schools turn outreach into accountable, equitable service. Finally, by linking home based counseling with community forums and grievance redressal, social workers convert one off visits into sustained mobilization that strengthens trust and improves maternal and child health outcomes. Social workers strengthen maternal and child health by fostering social support networks. Women groups provide safe spaces for sharing experiences, peer learning, and collective problem solving. Peer support for mothers reduces isolation, particularly for first time or adolescent mothers. Collective actions such as lobbying for local health facility demonstrate how social networks bring out the social capital. Bonding ties for trust and care, bridging ties to other communities, and linking ties to institutions, which improves help seeking and access to entitlements. Peer groups accelerate diffusion of healthy practices as mothers observe, imitate, and reinforce one another's behaviors. Structured facilitation turns informal support into accountable action, while caregiver clubs and father groups widen responsibility beyond women alone. Equity requires international inclusion of adolescents, migrants, lower caste households, and mothers of children with disabilities, with accessible venues, childcare, and modest stipends. Over time, these networks become advocacy platforms tracking service gaps on simple dashboards and engaging panchayats and health officials. So, personal support scales into policy change and measurable MCH gains. Gender inequality is a root cause of poor maternal and child health outcome. Social workers empower women to participate in decision making regarding their own health and that of their children. They also engage men, encouraging them to share responsibility for maternal health, parenting, and family planning. By combating gender discrimination at the household and community level, social work creates enabling environments for better health. Advocacy is central to social health. In maternal and child health, this includes advocating for safe motherhood as a right, ensuring access to skilled birth attendants and emergency care. Social workers also advocate for protection from domestic violence and harmful practices that endanger women and children. They push for accountability, ensuring policies translate into practice at the community level. Advocacy shifts power by elevating women and adolescents as right holders and making institutions, health facilities, police, schools, and panchayats answerable for results. Practically, this means helping clients file grievance, demand referral transport, and respectful maternity care, and secure entitlements, for example, of Janni Suraksha Yojana or Pradhan Mantri Matru Vandana Yojana, through paperwork support and follow up. Community hearings, social audits, and scorecards turned private complaints into collective bargaining for 24/7, basic and comprehensive emergency and obstetric care, zero user fees, and gender responsive infrastructure. Advocacy is also preventative, engaging men, mothers in laws, and faith leaders to challenge early marriage, dowry, and domestic violence while establishing survivor centered pathway to protection services and legal aid. Finally, disaggregated local dashboards and regular review meetings ensure that commitments move beyond policy into time bound, measurable improvements in maternal and child health. High risk pregnancies require targeted intervention. Social workers identify vulnerable mothers through screenings and home visits. They facilitate timely referrals and arrange transport to facilities. They also provide psychosocial support, helping families cope with the stress and reinforcing the importance of medical care. By bridging gaps in care, social workers reduce risks and improve outcomes. Newborn care is an area where social workers play a preventive and supportive role. They promote exclusive breastfeeding and educate families about neonatal danger signs. They encourage immunization from birth and monitor follow ups. Social workers also safeguard against neglect, especially for girl children, ensuring equal care and attention. Their early interventions lay the foundation for healthy childhoods. Maternal mental health is often neglected in routine services. Social workers screen for postpartum depression and provide counseling to affected mothers. They help reduce stigma by normalizing conversations about maternal stress and anxiety. They also connect mothers to specialized mental health services when required. Addressing maternal mental health improves not only the mother's well being but also child development and family dynamics. Adolescents are a key focus for social workers. They provide reproductive health counseling, often in peer friendly formats, to prevent unsafe practices. They advocate against early marriage and pregnancy, both of which compromise maternal and child health. Life skills education empowers adolescents to make informed choices, resist peer pressure, and plan for their healthier futures. Family planning is an important domain of social work practice. Social workers counsel couples on contraceptive options, ensuring informed choices. They address myths and misconceptions that often deter usage. Promoting male involvement reduces the burden on women and fosters shared responsibility. Social workers thus contribute to sustainable family planning and improved maternal child health outcomes. Nutrition is a major determinant of maternal and child health. Social workers promote breastfeeding and guide complementary feeding practices. They connect families to schemes like the Integrated Child Development Services and midday meal programs. They also address harmful food taboos such as restricting of nutritional food during pregnancy. By tackling both knowledge and access barriers, social workers strengthen nutritional outcomes. They also support immunization programs by mobilizing communities, organizing campaigns, and identifying left out children. They also track families to ensure children complete full immunization schedules. These efforts significantly improve immunization coverage, reducing child morbidity and mortality from vaccine preventable diseases. In emergencies such as floods, conflicts, or pandemics, social workers provide crucial maternal and child health support. They ensure continued access to safe deliveries, essential medicines, and nutrition services. They also offer psychosocial support to mothers and children traumatized by crisis. Protecting vulnerable children from exploitation and trafficking becomes a priority. Social workers thus contribute to both relief and long term recovery. Social work emphasizes participatory methods to involve communities directly in maternal and child health planning. Focused group discussions allow women and families to share perspectives. Community mapping identifies barriers to accessing services. Involving beneficiaries in planning ensures interventions are context sensitive and locally owned. Participation also enhances accountability and sustainability. Social workers collaborate closely with health teams, including doctors, nurses, and community health workers. This multidisciplinary approach enhances service delivery, combining technical expertise with social support. For example, while doctors provide treatment, social workers address counseling, transport, and family dynamics. Such collaboration ensures maternal and child health interventions are comprehensive and effective. Documentation is vital in social work practice. Recording of cases, interventions, and outcomes helps track progress and highlights gaps. Social workers often identify social determinants such as poverty, gender inequity, or violence that shape health outcomes. Their insights contribute to research and evidence based policy making, ensuring that maternal and child health strategies reflect ground realities. Social work practice in maternal and child health faces significant challenges. Resource limitations such as inadequate staff or funding restrict outreach. Resistance from families or communities, often due to cultural norms, creates barriers. They themselves face emotional stress from dealing with trauma and high caseloads. Addressing these challenges requires systemic support, supervision, and self care strategies. These obstacles reflect structural power imbalances, gender norms, caste hierarchies, poverty, and bureaucratic gatekeeping. So, solutions must pair individual coping with organizational and policy reforms. Practical supports include manageable caseload thresholds, regular reflective supervision, and peer debriefs to mitigate vicious trauma and clear safety protocols for home visits. Investment in skills, motivational interviewing, trauma informed practice, and culturally safe communication helps convert resistance into participation, while small untied funds and transport stipends enable timely problem solving. Burnout prevention needs institutional commitments, protected time for self care, access to counseling, fair remuneration, and recognition systems that value fieldwork. Finally, simple dashboards that track workload, follow ups, and outcomes. Finally, simple dashboards that track workload, follow ups, and outcomes disaggregated by gender, caste, disability, and location data create accountability so that staff well being and community equality move together. Strengthening of social work in maternal and child health requires training and capacity building to equip the workers with counseling and community mobilization skills. Supportive supervision provides guidance and emotional support. Policy recognition and integration of social works into health programs formalize their roles and ensure adequate resources. These strategies strengthen the profession and its impact. Capacity building should include trauma informed practice, motivational interviewing, and culturally safe communication that addresses gender, caste, disability, and migration so workers can navigate power dynamics and not just deliver messages. Supportive supervision must be structured. Regular case reviews, peer disbeliefs, and field mentoring to prevent burnout and improve quality with clear safety protocols for home visits. Policy integration is best realized through defined career pathways, inclusion in RMNCH planning teams, and budget earmarked for transport, job aids, and community activities. Accountability grows when social workers track referral, counter referral entitlements, secured, and follow ups on simple dashboards disaggregated by gender, caste, disability, and location. Finally, institutionalizing self care, protected time, access to counseling, and reflective practice sustains the workforce. So, strengthening skills translate into sustained maternal and child health gains. NGOs and civil society organizations employ social workers in community based projects, particularly in underserved areas. They advocate for systemic reforms, bringing grassroots perspectives to policy debates. By complementing government services, NGOs fill gaps in outreach, counseling, and rehabilitation. Their partnership with social workers enhances the reach and quality of maternal and child health programs. Future directions for social work in maternal and child health includes greater integration into health systems, ensuring every facility and community has access to social workers. Expanding digital tools for outreach such as telecounseling and online support groups can widen access. Strengthening community leadership ensures local ownership and sustainability of interventions. Social work will remain essential in adapting RCH programs to emerging challenges. To summarize, social work addresses the social determinants that shape maternal and child health outcomes. By offering counseling, advocacy, and community support, social workers complement medical care and bridge critical gaps. Their holistic and rights based approach strengthens outcomes, ensuring women and children not only survive but thrive. In conclusion, social work practices bring compassion, equity, and justice into maternal and child health care. They remind us that beyond medical interventions, women and children need dignity, empowerment, and social support. Social workers are the advocates and facilitators who make this possible, turning policies into meaningful realities for families. As we close, please reflect on the idea that maternal and child health cannot be achieved through clinical service alone. Families need social workers who care, listen, and advocate for their rights. Social work ensures healthcare is inclusive, equitable, and people centered. It is through this blend of social and medical interventions that we can realize the full promise of reproductive and child health programs. So, this is all for today's session. Next, in lecture 41, we deal with counseling and support services for reproductive health issues. Thank you.